When I started with Shelter House 11 years ago, I didn't have all this gray hair. So this is what working in homelessness does to a person. I'd like to talk about who it is that we work with, because I think in describing who it is that we work with, it well describes the issues and barriers that we face as a provider, and that folks in our community who are striving to even attain basic shelter, the issues that they're facing. Shelter House has existed since 1983, and we were established through a partnership of the Consultation of Religious Communities, so a coalition of local faith communities in the city of Iowa City. And we've evolved over time along a timeline that looks very similar to the evolution of shelter providers throughout the country. We've gone from a point where we were just a roof over a person's head and provided just that service, that bed, that roof, that meal, shower, to something much more substantial, where we invest in working with men and women and their families and help them to find employment, maintain employment, build employability, build on their skills, help them address their health barriers, help them become connected to the community so that they can remain in the community. That is where the vast majority of our resources rest at this time. The folks we're working with are as diverse as anyone could possibly imagine. We're a general homeless shelter, a general use homeless shelter, and that means that we provide shelter for men, women, children, the disabled, elderly, homeless veterans. Many organizations will really streamline and focus in on just a subpopulation, working, let's say, with only single adults or just with families. We've decided that the model of a general use works well for our community and the size community that we have. Now, in so doing, we've opened ourselves up for a great deal of diversity. At any point in time, who is homeless in our shelter, who's coming through our doors, we've got at least a third of the population having chronic substance abuse histories, about a third having serious mental illness, and then a third having purely an economic issue that they face. Now, that may sound like I'm oversimplifying, but it really ends up being fairly true to form for us. The issues that we see, the barriers that we see, are very consistent with those barriers that are articulated across the state of Iowa. However, I think that they're exemplified, or they're larger a little bit here in the areas of health, mental health, and substance abuse, because we have the University of Iowa hospitals and clinics in our community. We have the VA Medical Center in our community. And indeed, these two entities do pull people here who have profound health deficits, health needs, who are poor and have nowhere to go after they receive health care, or even during the time that they're receiving their health care. My program manager at the shelter often says, you know, we could do a random sample of folks throughout Johnson County and compare the level of folks who are working, the participation in the workforce, and compare that to the participation in the workforce of those who are staying at the shelter, and it'll be pretty equal. I think that oftentimes folks believe that people who are homeless, you know, there's some character flaw, there's something that they're not doing, they perceive that they're not working, that this is something that that individual or family brought upon themselves. And over the 11 years, I can tell you that folks are working, they're working really hard. If I could have Joe Hearn's slides up behind me, you know, they're right in that slide is the crux of the issue. We've got folks that are piecemealing jobs, part-time jobs between several different employers. They're not making even $11. It's far below that. They're not able to put together enough income to begin to afford housing in the private market. And so we're relegating and almost mandating that people then seek subsidy and public assistance. At the same time, we then are retracting and disinvesting in those public supports. For example, right now, our housing authority, the Section 8 Housing Choice Voucher Program, that list is closed. So folks are not able to access that as a resource. We've seen some substantial change over the last 7 years, more so than I think in the 10 years that preceded that. From 1983 through until probably the late 1990s, who was homeless in Johnson County consisted of primarily single adults, single men, with a very few number of single women. When I started at Shelter House in 1998, it was very rare that we would have a family coming through the shelter, and rare that we would see women. At our shelter, we only have currently 29 beds. And that's very relevant, and I can talk about that in a couple minutes. Over the last 7 years, we have seen an incredible change and shift in who is homeless in our community, and this, again, is something that is seen across this nation. Iowa City, Johnson County is just not that unique. In the last 7 years, we've seen families increasingly coming through our doors who are homeless. So much so that to the point we've got over 50% of who is homeless and who it is that we're working with are women and children. So 50% of our population now are women and children, whereas 10 years ago it was less than 20%. That's a substantial change. And the population statistics that Joe had placed when he said that 10% of the state of Iowa is a minority population. Johnson County, and in particular Iowa City, it's a little higher than that, but very nearly 50% of who is coming through the shelter today is African American. That's quite a statement right there. Who is poor, who is homeless in our country, who is being most severely impacted. And nonprofit organizations such as Shelter House, pretty small organization, were being thrust into the forefront of very politicized debates and issues. This change has so impacted us because locally, with 29 beds, we're very limited in our capacity to respond. When you have a single individual, by definition, they're coming to your door, they're looking for one bed. When you have a family, by definition, they're looking for more than one bed. Oftentimes it's 3, it's 5 beds, and we have been able to respond. I think that the short story behind why the market does not work for addressing the needs of the shelter needs for the homeless and providing housing for who is homeless is because, by and large, homelessness is a public ill. It's created by the market. And more we're privatizing our response to homelessness, and indeed it really needs to be a partnership that is borne on the shoulders of the public in participation and partnership with the private. These are folks who are not able to compete competitively in the market on their own. There needs to be supports. There are skills deficits, there are health deficits, and in order to address these, they need support, both financial and over a longer term, in being able to build the skills and work through a system that is almost set up to push them out from the onset. And I don't know that I'm making that very clear. But I've seen time and time again that folks have an intention to work. They have a desire to work, but they need the support. And we're able, through this nonprofit organization, to walk side by side with folks and help them to get through that door. But there are so many barriers that exist, from not having a local job reference to, again, lacking basic skills and not being able to compete with others as competitively. So sometimes we're asking people to take a risk, both employers and both housing providers, to take a risk in offering people an opportunity. And it is not just a purely business kind of decision that can be made to address the issues that we're talking about here. When I read the articles that were related to this discussion tonight, the one on the case for a right to housing, I have to tell you, just a little part of my heart just kind of clenched, because this was written in 1998. This is when I started at Shelter House, and I could say that with passion, I vehemently believed that all people deserved a right to housing. And there is this burning part of me that I still believe that there is a right, people have a right to housing. But now I've atrophied and I've reduced my expectations to say that in the very least, people deserve a right to basic shelter. It is an essential need. It's a basic need. And in all of these years that I have been working, I have seen the problems continue to grow. And they're very straightforward. For those who are least able to compete in the market, those who are living in poverty, at or below 30% of median income, they still deserve a right to shelter. And we're not helping our communities, whether it be here in Johnson County or beyond, by not addressing this basic and essential need. Whether you define it as a right, it is a basic need. And we're compromising the health, the safety, and the well-being of the overall community in not addressing this. When children are introduced into that equation, it becomes that much more magnified, because their experience at that time when they're going through their developmental stage, to have known that much insecurity in their lives during those years, and that is informing them as they grow. I truly worry about this and agonize over this. So I could talk for quite a period of time over about the issues of homelessness here locally. There's one comment that I'd like to share, I guess, that I think was very impactful to me just as recent as last week. I was interviewed by folks who had been hired by HUD to review in local communities, or at the local level, information that the data does not tell people, to hear from individuals who have been providing services, and in their words, talk about what the issues are, what we're seeing. And over again, I heard myself saying, you know, the issues aren't really changing, other than the fact that we've got large metropolitan areas that are entirely demolishing their their public housing, and that this impacts our local communities. People are moving. Who is moving? The fact that people are African American or black, they're coming to our communities, and nonprofit agencies are thrust into the forefront of having to deal with those issues and kind of left out there on their own. That the issues are not changing. The issues are becoming more profound and more complex, that they continue to deal with issues of access to health care, access to substance abuse services and treatment, mental health treatment centers, the ability to pay, the access to jobs that pay a living wage. And if we're continuing to increase jobs that are in the service sector and not paying what housing costs, you know, it is intuitive then to know that we are going to have increasing problems with people being able to afford housing and the most basic types of housing. But this individual said to me, you know, over these years, Crissy, you've been working, you've been trying to build this new shelter. You need to understand that the world has changed. And essentially telling me that I'm kind of a relic and I don't understand, that the world has changed, and the mechanisms that we now have in place are these fantabulous new legislative products that are going to create an entirely new paradigm as to how we're going to work through homelessness. And it is just as simple as, I think my response was, the world has changed, but you know, the people haven't. The issues that they're facing, the problems that they're dealing with, those have not changed. And you know, we really need to do something, and it can be a very simple thing. So the studying, the complexities, we can get lost and mired in that for years. But coming together as a local community and addressing the issues that we see at a grassroots level, being honest about what the issues are at a grassroots level, and trying to do things together, collaboratively, collectively, I really think that that's where the answers are. So thank you very much for your time.